All right, we got it recording. Again, welcome everybody. Happy October. Can you believe that it is October? Did it feel like October out there today? I heard that it was 81 degrees out. What a beautiful fall day out there. Just gorgeous time of year. And there's these things up in the tree that are changing color and falling down. And this is one common cause of subluxation these days for lower back issues. We'll be getting into the yard work and things like that. But what great weather that we've been blessed with. So that also means is that my patients are wanting to get outdoors. They're wanting to go for walks, other activities. So we want to make sure that the body is equipped to do these things. So we're going to get into Bulletproof your lower back. If you're a note taker, you want to grab a notebook and a pen, maybe 2 pens in case you run out of ink. I'm going to talk fast, so write fast. If you're listening, listen fast too. We should be getting through this information in 4 hours. Just kidding. Okay, just seeing if you're paying attention out there. We should be done 60 minutes or so. And at the end, I have some really great exercises I want to share with you about things you can do to bulletproof your lower back. So let's go ahead, gang, let's dive in and take a look. This is how people are showing up in the office when it comes to lower back issues these days. You can have low back pain. You can have tight muscles. You can lose some range of motion. Things are feeling stiff. You can have leg pain with low back issues. There could be swelling, burning, numbness, just to name a few things. We could get restless leg syndrome, sciatica, those type of things. And those problems originate in your lower back. And so let's go through some basic anatomy here. Pay attention because on your next visit, I'm going to ask you questions on this, okay? Just kidding, but here we go. We have the lumbar spine. That's the lower vertebrae. You see the section in the center here where it's in a darker gray around the white spine. And this is made up of 5 individual segments. And so you have the bones, and then in between here, there's the disc. The disc is the spacer, okay? The disc is the spacer to allow ample room for the nerve to pass through the nerve hole here. And that nerve is going to communicate specifically to organs and muscles in different areas within your body. So there's the disc there, and then the vertebral bodies, and then there's 5 of them. And the whole reason why you want an optimal curve in the spine when we're looking from the side is because the curve is the shock absorber in the spine. It absorbs the shocks in that. It's not the discs itself, okay? It's the actual curve. So that's why we want to have the curve there. And then when we're looking at the spine from a straightaway view, we want to have it nice and straight there. So there's some general anatomy as we talk about the lumbar spine. And just disc herniations, we hear that term all said a lot. You have the disc is think of it as a jelly donut. And so I know none of you know what a jelly donut is, living a wellness lifestyle out there, but we're going to use a jelly donut as an analogy because the disc is made up of 2 things. There's a very hard outer ring called the annulus fibrosus, and the center is called the nucleus pulposus. It's a very gel-like. And so in a normal healthy disc, you have a strong outer wall, and then in the center is a jelly. But what happens in a disc bulge is where the walls of the disc start to bulge outward. So if we can see that on the screen, it bulges outward. But where the herniation comes in is where this spot right here, that red, is you get the pressure and the jelly starts pushing out right there, pushing out on that nerve. And if you've ever had a disc bulge or dealing with one or a disc herniation, they're not any fun because this will impact the nerve as it exits the lower spine, and it travels into the buttock and all the way down the leg into the bottom of the foot and into the toes. That is called sciatica. Sciatica is that when you have radicular pain, When you have pain traveling from the lower back, it goes down the buttock, down the back of the leg, down to the bottom of the foot and into the toe. That's sciatica. You can have radicular pain where it goes into the buttock. You can have pain that goes down the back of the thigh and stops at the knee or just below the knee. That's not true sciatica, but that's a form of sciatica. And the sciatic nerve is your largest nerve in your body. It's about the diameter of your thumb. So take a look at your thumb. That's about the size of that nerve. So it's a big nerve. And when there's pressure on it, it can get very angry and it starts screaming at you. And that's where the sciatic type pain is. And that all originates in the lower back. And that's made up of 5 nerve levels as it comes right off of your spine right here. There's 5 of these nerves that all form the sciatica, and it goes right through the buttock, hip region, down the back of the leg into the feet. So a lot of critical anatomy there, that if there's a problem and pressure on that nerve, like where this picture is showing this disc herniation there, it puts pressure on that nerve and it can cause dysfunction. Now, I say dysfunction first because you don't have to have any pain with this. It is true, you can have a disc herniation, you can have a disc bulge and not have any pain. And a lot of times that this is the sleeping giant, is that you don't have any pain, but there's been an underlying problem that's building up over months, years, decades, and then we cough, sneeze, or there's some lifestyle trigger that starts to produce pain. So sciatica is right here. The nerve root right at the bottom of the lower spine gets irritated. You can see all the red, pain, 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 inflammation. You get numbness, tingling into the buttock, legs, and feet. This also could cause weakness. So you go to walk and you don't have the strength in your leg. That can lead then to other problems, falls, so on and so forth, which can cause secondary or tertiary conditions. So how do we know you have a slip disc or a disc herniation? We have special imaging, and this is done through an MRI to confirm everything here. So slip disc, by the way, is a misnomer. Your disc can't actually slip. So I know it's a layman's term to say that the disc slips, it slips out of position, but really what we're saying is the disc herniates. There's a breach in that outer wall. So on the lateral lumbar, so when we take a look at the lower back from a side view, we got healthy, normal, and then in the middle picture is unhealthy. So healthy, normal, I want to educate you here on what we look for. Number 1, there should be a forward curve. Number 2, there should be good spacers in between those bones. Those are the intervertebral disc, and then the bone should be nice and square, nice smooth edges there. And if any of those areas are compromised, then these dark circles on the backside, these are the nerve holes there. What will end up happening is it becomes compromised. And if you take a look at a healthy normal to abnormal, we look on the x-ray, how's that curve? Well, it's straighter, right? And how about the spacers in between the bones? They're a lot tighter than what they were before. And what about the edges of the bone? Are they nice and smooth, or are they irregular? Yeah, they're irregular, right? Because you see there's some bone spurs that are forming, and these things take 5 to 10 years to develop. And then we take a look at the nerve holes on the backside here, and they're not as patent, they're not as open as what these other ones are. So we could see that's compromised. It's kind of like I-66. If it's like healthy normal is 4 lanes open for traffic, then we move to 3 to 2 to 1. What happens to the traffic? It gets congested. It's the same thing here with the nerves and that are traveling down the legs there. Then right here, then the MRI, what we can see in that yellow circle where the arrow is, that dark material is the disc. That's the disc in between. And we can see that some of that disc material is white in the healthy segments up above, but the lower we go, it's dark. That means that it's dehydrated. That means essential nutrients and blood flow cannot get to the disc, is breaking down, is wearing down, making it more susceptible to becoming more brittle, cracking, and then now there's a breach in the outer walls, and that's where the jelly comes out, and that's where we get a disc herniation. And so that disc herniation can put pressure on the nerve, relate to symptoms like sciatica, and really impact the the lives of many people. You know, the low back issues and that, I mean, it's just astonishing the impact that all these things are having in our overall quality of life and how it's impacting just everything that we do within our life, day in and day out. Just a routine, simple things that we take for granted. So these are the things is how it shows up in our office for our patients that are coming in, maybe in the 20s. People are coming in and there's just, maybe they just have a lost range of motion, some tight muscles, and then stiff. And then we move into the 30s. And then now we're sitting a lot at a computer. We're becoming more sedentary, and maybe we start to get some back pain. And then we move into our 40s. And then now that back pain starts to travel into our buttock and then down the leg. And then when we get in our 50s and 60s, there's more burning, numbness, swelling, loss of function down our legs, so on and so forth. So this is how these things start to roll if we don't deal with the underlying root cause of the issue. And so what are our options out there? You know, I get these questions, you know, hey doc, should I do heat? Should I do bed rest? Should I take these drugs? You know, my question to you is anytime I get this is, what is your goal and what are we trying to accomplish here? Okay, what is the goal? What are we trying to accomplish? Is it symptomatic relief? Are we trying to treat the symptoms, manage the symptoms, or are we looking to get to the root cause of the problem? Before I can answer that question or direct, I need to know what is your goal. And we want to look is it safe and effective? And we want to also be asking is, are we looking for the short-term solution or are we looking for a long-term fix here? So how bad is it today? I have some the latest stats about this healthcare crisis. People with low back issues, 80% of Americans are going to experience low back issues at some point in their life. I mean, that's really crazy to think about, that 80% of us will experience back pain at some point. And 35% of our population has low back pain at any given time. I mean, this is at epidemic proportions out there. And the incidence of low back pain is up 29 to 34% just since 1997. So, I mean, you know, are people sitting more or more these days? Are our lifestyles getting worse or worse? Okay. And I'm talking about trends here. And unfortunately, we're sitting more and our lifestyle choices are driving us away from health and more towards illness and disease and disabilities here. Back pain is more common in females. A third of females suffer back pain, and 31% of men report that it affects their work, with only 20% of females reporting that. So clearly, females are tougher. Sorry, guys, that's what the stats are showing. And 54% low back pain sufferers are desk workers, and sitting is now the new smoking. 18 studies last 16 years have proven how sitting is worse for our health outcomes than smoking. And we all know how bad smoking is. Now, 50% of women experience back pain when pregnant. And that, just as a sidebar note, is that's one of our specialties here in the office. So if you know somebody that is pregnant and suffering from back pain, it doesn't have to be that way. That's one of our specialties, and we help women with that all the time. Cost is directly and indirectly $50 billion in direct costs for low back pain and $100 billion in indirect costs. So is this a problem or a problem? And so the sad thing is I can rattle all these numbers off to you, and they sound so big, but really we don't want to lose what is most important in the shuffle here is your quality of life and how it's impacting that. You know, people are missing work, they're losing money, they're being less productive, their jobs are being impacted. They're missing the play part of their life. You know, work hard, play hard, forget about the play these days. You know, people stop doing the things they love. They stop exercising, they stop having an active lifestyle, and then it becomes a downward spiral. I've seen it multiple ways present in our office post-COVID. I had people that were exercising diligently, and then they stopped going out, and they've been in their houses ever since, and just rarely go out, maybe come to our office or the grocery store. And then I've had other people that Now they have all this new time on their hands, and so now they want to start exercising, but they've not invested in any exercising in the past, several years. And so when they went to exercise, now their body's not able to handle that. So we start living around the problem, and we stop doing what we love. And that's what hits home for me, because I wake up every morning to help people with their health and their wellness, and get back doing those things that you love to do and want to do, and not work around the issue, but actually solve the problem, get to the root issue, and increase your quality of life. But unfortunately, it can get worse. Is that acute pain, if we don't deal with the root cause, it turns what? Turns chronic. You're exactly right. And then it can lead to drug use. We start with over the counter, and then it moves to more heavier prescriptions. And now we got a big opioid crisis. And that kind of got lost in the shuffle. That was on the rise and gaining more news and in the headlines more. And then COVID hit, but it's starting to resurge in the news, and you're seeing more and more of it again. And the prescription pain pills, and then the illegal street drugs. So it's become one of the hottest topics in our nation right now, is the opioid crisis, and what we can actually do here to help. You see, you take a look at the stats and what's going on. Um, the increase of legal narcotic production from 1993 to 2016. It just going vertical here. And most of these things, like OxyContin, Percocets, Vicodin, and then there's more right on here. But they're getting stronger and stronger, and now they're the number one class of drugs sold in America, even more than statin drugs and anxiety medications. And so when we take a look at how prevalent it is, we take a look at where the red is that's the highest. This is opioid prescriptions per 100 people. And we can see, it's just mind boggling. There's over one prescription per person in those red states right there. And even in the green states, it's like 50% of people per 100, have a prescription. It's critical now. And lives, families, they're being destroyed because of this. And so we want to see what part we can play in to help educate you, and giving you the knowledge and the tools to help us help you by addressing the root cause of the problem, and doing specific things in your lifestyle to help you get the best results. And we take a look. 40 people a day died from narcotic prescription overdose. That's enough prescription painkillers, and enough prescription painkillers were prescribed in 2010 to medicate every American adult around the clock for a month. Just epic proportions. And the overdose deaths involving opioids, cocaine, and heroin from 1999 to 2010. The red line is the opioid. So you can actually see that cocaine deaths had dropped, but the opioid has gone through the roof, through dramatic proportions there. It's crazy to see the increase with that there. And it's in the news. It's all over the place. People are talking about it, and nobody really has a concrete solution for it. We believe that there's a better way here, and I believe that this crisis started because of the drug culture in our society today, where for every ill there is a pill. So for every problem there's a pill. For every pain there's a drug. And we don't have a healthcare system today. We have a drug culture, and so it's just commonplace where you have a pain, and then you're prescribed some sort of drug to help with that pain, but nothing is done to fix the underlying root issue. I hope you can see the insanity behind that, because you could actually feel better, but becoming more unhealthy. So what are our options out there? We take a look, doc, should I do these ones? Again, it just depends on the goal, but allopathic options, where we're treating the symptom, heat. Unfortunately, that can lead to more inflammation within a swollen joint. So even though it might temporarily feel good underneath, it's creating more inflammation in the joint, the disc, and on the nerve. Bed rest, we know that that's not a great option because that leads to less imbibition. And imbibition is where the joint and then the disc is not getting movement. And through this movement, this is why we have the wobble chairs in the office and we ask you to sit on it to warm up your spine before your adjustment, is that imbibition. When your joints aren't moving, that means blood flow and essential nutrients are not getting to the disc and the joint itself. So, it's going to atrophy the muscles because if you don't use it, you lose it, right? The drugs, they can cover up the body signals, those warning signs that there's an underlying problem, and then, actually make the problem worse. For physical therapy, love physical therapists. They're really good at working at the soft tissues around the joint, but not addressing the underlying problem. Steroids, they're dangerously powerful anti-inflammatory. And for some people that are in an acute crisis, can really, in the short term, help get them out of that acute pain. But the studies show that it has long-term joint damage over time. And pain management, not really addressing the root cause of the issue. And surgery, we got to be looking at, safety, efficacy with this here, because the truth is that these back surgeries, they fail a lot for people. And I hear it time and time again for people that are in the office. And unfortunately, this may not fix the underlying root issue, and it can lead to secondary or tertiary issues down the road. And, we have to look when they measure the success rate by the surgeon standard, is there could be a 90%, let's say success rate. Everything went according to surgery the way it's supposed to be. But the real success comes when you start measuring the outcomes for the patients and where they're at. And it doesn't match that way. They, patient outcomes might be on the 20% of the spectrum. So we got to weigh the pros and the cons here in these situations about safety, efficacy, addressing the root problem, and then use this option as a last resort after we've exhausted the other options there. But for me, there's got to be a better way. And this is what I help coach and lead my patients on. So if I were you, especially when it comes to getting any procedure done, anything that carries risk, but what you want to be asking yourself, or any of these procedures, is what are the risks of this procedure? What are the costs, not only money, but time and energy involved in the process? What are the expected outcomes? Asking, the doctors if they can, if you can interview 10 of their patients, what's the research saying? What are all your options? So you make an informed decision out there. And that, is this treating my symptoms, or is it actually causing or correcting the cause of my root problem there? Those are some very powerful questions. And I want to arm you with this knowledge, because I find that my clients that are armed with better knowledge are able to make better healthcare decisions and help them lead towards the goals that they're actually trying to accomplish, not just mask the underlying symptom, or mask the symptom, but actually address the underlying root cause. Here's what's cool, when it comes to chiropractic compared to prescription medications and physical therapy, we ask about safety and efficacy, adverse outcome risk, addiction issues. Chiropractic is very safe with favorable outcomes. And this happens time and time again, how chiropractic is ranking out there and helping people get off drugs, avoid surgery, help reduce hospital costs, so on and so forth there. Now, you might be thinking, well, if chiropractic has all these great benefits, how come my primary care doctor or my insurance or so on and so forth, they don't recognize this or tell, cover more of this and so on and so forth? I have to share with you an insight, is that there's not a lot of money in healthy people. Unfortunately, our sick care system is big business to the tune of trillions of dollars. So there's a lot of money wrapped up in sick and unhealthy people. Therefore, then there's not the incentives from the insurance companies and the pharmaceutical companies and the food industries and things like that to be helping address the cause and teaching you to live healthy lifestyles. More we come into our society and accepting of just managing and just covering up our symptoms here and not addressing the root issue. Now, I know each and every one of you that are tuned in here are an exception to that. I know you all care about your health and you're an action taker, not only because you're in the office, but you're watching this webinar and you want to make sure you're doing everything that you can to promote health and wellness and address the root cause and live the life that you want to be living here. So these are the warning signals. These are the body signals. These are the symptoms that your body is trying to communicate to you. And anytime this is going on, it would be wise for us to listen to the body, not ignore it, and figure out what the root cause is and make sure that we're moving in the right direction, listening to these whispers. Therefore, we don't have to hear the screams. If you're with me on that, raise your hand here. Body signals are just the tip of the iceberg here. And so when people come into the office, right here underneath the water, or excuse me, above the water is the tip of the iceberg. This is the signal, this is the symptom that drives you into the office. But during our evaluation and upon examination underneath the water, this is the root cause of the problem. And people can be coming in, they might have had a problem that was slow growing, that maybe it was going on for 6 months to a year. Some people are at 5 years, and then we might see the 20 to 30 years of an underlying root problem developing. So when it comes to health outcomes and the time it's going to take, we need to consider that into the equation and how long it's going to take. So the illness wellness continuum, I really love this chart right here because symptoms tell us what direction we are actually heading in here. And so when you take a look at this, if you look at the neutral point, go ahead and put a 0 there. We got high level wellness off to the right side, and then we got premature death on the left side. So high level wellness is a +10, premature death is a -10. So rank yourself where you're at on this illness wellness continuum on -10 to +10. So think about this. Because where we're at and what tonight is all about is moving people to high level wellness, moving people to an awareness. So there's some things that I'm going to be sharing with you tonight that are going to raise your awareness and consciousness of what's going on in your body. A doctor means teacher, so this is educating you. And then we want to see growth in this. So we start applying it into our life and trying new things. It's seeing how our health is improving. And we want to avoid the signs, the symptoms, and the disability. The treatment or allopathic paradigm moves us from the disability, symptoms, and signs and gets us to the neutral point, but it's not doing anything to promote health. There's 3 actual tiers of healthcare out there today. There's a disease care where the doctors are just trying to keep people alive. So let's use an example with COVID patients in this situation. So disease care is just trying to keep people alive, the ventilators, things like that. That's what disease care is all about. Preventative care is, I'm sure you all have extra bottles of this lying around, but hand sanitizer right here. And then let's see, what else do we have is we have the hand sanitizer, the no hugs or high fives. It's kind of the elbow bumps these days. And then social distancing. That's what's called the preventative stage. Okay. Those preventative things are important, but it does nothing to promote health. And the 3rd tier is health promotion. And this is what we're talking about here tonight, to help promote health from within and help your body be as healthy and as strong as possible so that we can advance it beyond just the sick care model out there. So think about where you're at on this illness wellness continuum. And if you keep doing what you've been doing, you're going to keep getting what you've been getting. So we're going to unpack some lifestyle strategies, things to do, things to avoid to help you on your journey here. Here's a really cool graphic, is that less than 10% of your nerves sense pain. So Dr. Travis and I can always tell more about how your body is functioning than how it's feeling, because there's more to the nerve than just pain. So if we take a look here, is there's the motor nerve component where the nerves control the muscles. And when there's pressure on this part of the nerve, it can relate to tightness and spasms, or then weakness or fatigue. And then we get the autonomic nerves are impacted. Those control the blood vessels, glands, and organs. So sinus and allergies, energy, digestion, and breathing. With low back issues, digestive system can be impacted. Bladder can be impacted. Reproductive organs can be impacted. Those are also areas that have nerve flow from those areas. So you can have pressure on the nerve and not have any pain. That's why the second reason that we have this healthcare crisis today is because we think that symptoms are the first sign of a problem, when the fact is that they're typically the last sign of a problem. You know, is heart pain an early or a late sign of a problem? That's right, it's a late sign. And what about tooth pain? A late sign also. Are there any early signs of cancer? When I talk to oncologists out there, that cancer can take 5 to 7 years growing in the body before you become symptomatic. So we can't just rely on feeling telling us everything. It's about function. And feeling good does not equal good health. Good health comes from healthy function. So this is the nerve supply graphic right here. Your brain sits on top of your spine right here and sends signals through the spine, and then it branches out and goes to the individual nerves here. And in the office, what we're evaluating on your initial visit and then every single office visit here is for subluxation. A subluxation is a misaligned bone here that can impact nerve flow. You have your suit of armor that protects your spine. And then we want to make sure that the spine stays in proper alignment, because in between those bones are those nerves that come out. And if those nerves that go out in between the bones become compromised, that'll lead to low back issues, pain, stiffness, tightness, loss of range of motion, burning, swelling, and then impact the nerves that go down the leg. So if you want a healthy body, then you're going to need a healthy nervous system. And if you need a healthy nervous system, you're going to have a healthy spine. So this is what happens here when the nerves get irritated. It triggers an adaptive physiology and a stress response in the body. So raise your hand if you're under a lot of stress these days. Okay, I should see like all these pings coming in with the hands up. And we think we can all agree that modern life is unnaturally stressful. And with everything that's been going on recently, life has gotten even more stressful. So all this stress starts to have an impact in the function of the nervous system. So I like this breaker switch analogy. Has anybody ever plugged in too many appliances to an outlet and overloaded the circuit? And what happens to the breaker? Very similar things happen within your nervous system. So when you're healthy, your body can handle the amount of external stress, and it can adapt from the internal resistance. But if that external stress becomes too overwhelming for that internal resistance to handle, that's where we start to get breakdown in the body. That's where we start to get some signs of the body leading to symptoms and then dysfunction. So during the stress response, that's that fight or flight. And in the short term, it's a very healthy response. Long term, it leads to chronic illness. Short term, the adaptive physiology, when we have a subluxation and when we're in pain, is blood pressure goes up, heart rate goes up, muscle tone increases. So think about when you're under stress, how your blood pressure, heart rate, and your tension in the muscle increases. Then you may have experienced your digestion being upset. Then you might see a decrease in your sex drive or reproduction drive. Decreased serotonin levels meaning your sleep and your happiness can be impacted. Then you're increased in the sensory system, which means that your pain signals are going to be increased. And you have more fear and anxiety. Your immune response goes down. So you become more susceptible to viruses in your environment, bacteria, other pathogens. Your insulin sensitivity is downregulated. So then your blood sugar level goes up, and that leads to more inflammation systemically in your body. Well, we know that inflammation is the predecessor to pain. Then your HDL decreases and your LDL increases. So you get the numbers going in the wrong direction when it comes to your overall cholesterol. And then your clotting factors increase. Now, I don't know about you, but this is like a recipe for stroke. And this is why we have such a rampant crisis in heart disease today, and stroke, and cancer, and diabetes, and obesity, is that our lifestyle is eroding our health and well-being over time, and it's taken us to places far away from our intended goals. So here's our premise in our office at Pure Chiropractic, that healthy is normal, sick is abnormal. But unfortunately, sick has become the new norm. Your body is smart and it's intelligent and it wants to be healthy. There's no research that proves this otherwise. You're designed to be healthy. Your nervous system is the master system. It is the system that processes and filters the stress in your life. So the more function in your nervous system, the better health outcomes. The more drag on the nervous system, then not so good with the health outcomes. Has a global impact on your overall well-being. And your spine is your suit of armor. It is your defender and protector of your delicate nerves. And as we talked about, modern life is unnaturally stressful. The three types of stress that we talk about out there are thoughts, toxins, and traumas. And the traumas are broken down to macro and micro. So these are common causes of low back issues. And these can start a year, 5 years, 10 years, sometimes 20 or more years ago, even when you didn't think there was an issue. One is like car accident. Just 5 miles an hour of impact can cause a subluxation or a misalignment. And if you didn't detect that there was any pain, you probably thought there was no problem. So you just went on living your life. But these can be this could be the start of these underlying root issues. But also with this category would be slips and falls, sports injuries. And these are some of the more serious causes of subluxation and some of the more obvious. But there's some things that are not as obvious. And this could be, fall, winter season, spring season, yard work, things like that. Now, I know Northern Virginia really doesn't know anything about snow. I can say that because I'm from Michigan, and I know every once in a while, it seems like maybe every 10, 15 years we get hit with some snow, but right now, think yard work. A lot of my patients coming in, they're the fall cleanup, so on and so forth, a lot of stuff in the yard, physical activities on the outside. These are activities that can cause subluxation. And more prevalent today is owning one of these things right here, cell phone. I know that many of my patients have 2 cell phones. And any of this tech here today is leading to a condition in the spine where it's causing our spine to deteriorate faster than in unprecedented ways these days. And so how many of you can relate to these people on here? How about your family at home, kids, things like that? And our lifestyle has become incongruent with matching what our body needs for ultimate health, high-level health and wellness. Just think, sitting 3 hours a day does the exact same thing to your spine and nervous system as what sugar does to your teeth. It just starts to add up, and sitting becomes a new smoking. And it's like the 8 to 10 hours a day of sitting through the week then starts to add up on the weekends and then longer hours throughout the day. And now it's just too much. And then now it starts to impact our life. And we start working around our problem instead of living our life full out. and it creates a condition called subluxation. Subluxation is a joint misalignment that causes soft tissue damage, that inflames the joint and irritates the nerve, causes muscle spasms and pain. You lose the good fluid, the blood flow, lymphatic fluids, and nutrient going to the joint and the disc, and the joint becomes stuck. We call it movement deficiency syndrome when your spine's not moving the way that it should. Because if the lower back is not moving as designed, along with the pelvis and then the hip right here, then what it's going to end up doing is causing pressure on the disc and then the nerve, and then irritating the spine. And it's like we say at Pure Chiropractic, we don't want your spine getting on your nerves. All right, I know there's some corny humor, cheesy humor there, but I hope it got a smile out of you. And then it leads to this adaptive physiology and the stress response. Now, I'm not going to go through this again with you, but I am going to quiz you on the next time I see you in the office. So I hope you took good notes on this one. And again, in review, that less than 10% of your nerves sense pain. So how do you know if you have subluxation? How do you know if you have harmful nerve interference that is impacting the way the body is functioning? Well, the simple statement here is you get checked, so you know. Now, some of you are current patients and you've already gone through our initial exam process, and we discovered subluxations that were the root cause of your problem. And on each one of your visits, we are adjusting your spine to correct the subluxation. And if Dr. Travis and I are doing our job, we're helping to coach you outside of the office of things to do, things to avoid, to help improve your health and healing. So if you are not currently a patient, you may be wondering if you have a condition called subluxation. Or if you're on this webinar and are currently a patient, you might be thinking of somebody who is at home that wondering if they have subluxation. And how do you know? Well, you get checked. And we use objective criteria in our office to identify subluxation. We have the Insight Core Score. And so then we can measure how your nervous system is adapting to stress in your life, physically, nutritionally, mentally, and emotionally, through specific instrumentation and the motion and static palpation of when we're feeling the spine, looking at posture, and then taking x-rays. And then we can identify if you have a condition of subluxation. We can identify how long that it's been there. And then based on your goals, we can set up a plan or a path to help you achieve your goals and save time, money, and energy in the process. So in our office, we talk about the three-legged stool of optimal health outcomes. So if you're taking notes, you really want to take notes on this next segment as we wrap up our workshop here. These are the do's and the don'ts. We have a stop doing and a start doing list, or a slow down. So think of it as the red light, yellow light, and then a green light. And we call it the three-legged stool of optimal results. Number one of the leg of the stool for optimal results is your chiropractic adjustments in rhythm. And what I mean by that is, based on where you're at in your care, make sure that you are maintaining the frequency that is recommended to you. That 3 times a week means 3 times a week, or 2 times a week means 2 times a week, 1 time a week means 1 time a week, so on and so forth. Don't skip or miss appointments. This can significantly impact your results and detract from Dr. Travis and I doing our best results and our best work for you. So make sure you keep your appointments in rhythm. And I know that each and every one of you that are watching currently, I've been doing a fantastic job at keeping your rhythm. So pat yourself on the back for your commitment to your health and your health outcomes. The next leg of the three-legged stool is breaking bad habits. We all know, I don't have to tell you, you're very smart and you're intelligent. We all know that we have poor health habits. We make poor lifestyle choices. Look, we are human. I totally get it. So when I talk about these things, I want you to be thinking about progress, not perfection. Perfection doesn't exist here. In fact, my clients in my years of being in practice that are trying to be perfect with everything that I'm talking to them about and doing are some of my most overstressed patients out there. It's not serving them. So I just want you to use progress, not perfection, as kind of the guiding principle here. How are you getting better every day? Just small steps every single day, hitting singles every single day is going to add up to big wins and results tomorrow. So never lose sight on that principle. Don't focus on what you can't do or what you haven't done. Focus on what you can do and what's in front of you. And if you misstep one day, continue loving yourself. Pick yourself back up and then hit it the next day. There's no guilt, no shame. That's not going to help you on this journey. It's about progress. I want you to know that Dr. Travis and I are your health coaches. We're here to help support you. So if you have questions, concerns, you're stuck along the way, let us know. We call it the 3H approach. Sometimes we need a high five. Now we need, these days we'd say a hug, but maybe it's a virtual hug or then a virtual headlock. However you respond well to coaching, that's how we can help you. And just encourage you along the way of focusing on what you can do. Remember, success, it comes in cans. Okay, so here we go, three-legged stool. And then the third leg of the stool is exercises to strengthen your spine. So now that we're getting the spine in better alignment at the appropriate time, doing specific activities to help strengthen the muscles along your spine, particularly what I'm going to teach you in your lower back, to help prevent recurrence of subluxation and minimize any of the backsliding that can occur in between the adjustments because of our lifestyle choices. So we're going to get into some specific exercises that I was taught to me by a good friend of mine, and she was my former personal trainer. And you know her around here. You see her all the time in this office. Lynn is also, a little known fact, a personal trainer. And Lynn did a specific workshop when we were hosting this in the office, and we would do a hands-on. So these are exercises that she taught me, helped me with. It's been helping our clients. I totally recommend and endorse these. So if you have any issues with these or any questions, Lynn is qualified to answer this for you too. And that Dr. Travis or myself will come alongside you. And clinically, if you're having any pain or discomfort with this, let us know, because then we'll be able to help guide you. If you are a guest and you're tuning in and you're watching this for the first time and we have not done an evaluation, I would recommend you come in and get checked first so that you're not doing things that could actually make your condition worse. So it says right here, I love this cartoon. My doctor told me to start my exercise program very gradually. Today I drove past a store that sells sweatpants. Okay. So I guess that's progress, right? Progress, not perfection. All right. So if you have the capability, if you are available to get up from your chair, if you are able to join in physically and try some of these along the way, I encourage you to do so. If not, then you can rewind this and watch it when I send the replay link out, and you can go right to this point and then look at these. If you're already doing them, fantastic. We'll go over some technique. And if you're not, you can start incorporating them in. But remember what we said, PAIN is an acronym for pay attention inside now. It's a body signal, so don't blow past the pain signals of the body. You're not going to get points for no pain, no gain. Pain tells us there's an underlying problem not being addressed, and we need to address it. So let's take a look, the wall sit. So how you're going to do this is you're going to stand with your back flat against the wall and your feet about 1 to 2 inches away from the wall. Essentially what you want to be doing is creating a 90-degree angle between your hips, your lower back and your thighs at the hip joint, and then from your thighs to your lower leg. You're going to hold your arms at your sides or across your chest, bent at the knees, and lower yourself down until your thighs are parallel to the ground. Now, there's a lot of modifications to this, and I don't want you to think if you're just getting started, you have to go all the way to this position. What I would encourage you is to lean against the wall, and maybe what you're going to do is sink down 1 to 2 inches and start there. Hold the position for the desired time. What you want to be holding this for is 30 seconds. Now, if you can't hold it for 30 seconds, you know what? It's okay. You might just get into this position, have a chair or two to your side so you have some stability to help get you out of this position if you need to. And you might just hold it for 5 seconds. And that might be where you're starting, and that is okay. Then you're going to progress from there and then build up. But you'd want to do 3 sets of 30 seconds is what the desire would be. You're going to strengthen your quads, your hamstrings, your lower back, shoulders, and your core. And yes, by doing these activities for your lower back, it is going to help your shoulders and your upper body and neck. And just for a little plug, in the month of November, we're going to uncover how to bulletproof your neck. It's going to be an awesome workshop, so stay tuned for that. This is, you're going to line up, this lines up the ankle, knee, and hip, okay, when you're in the standing position. So there's the wall sit. Now the next one is the squat. We taught this in the adult onset FAS program, or also known as falling apart syndrome, that we did in August. And we talked about doing 20 squats per day. So if you were at that adult onset FAS webinar in the month of August and you were in the part 2 segment, my question to you is, how are you doing with your squats? Okay. If you're new to this, then what I want you to do for the squat is you're going to stand with your feet just over shoulder width apart. You're going to keep your back in a neutral position and keep your knees centered over your feet. You're going to slowly hinge your hips and sit back, lowering yourself to reach a 90-degree angle. Knees should bend by themselves. So you kind of want to sit with your weight on your heels. And then you're going to sit like you're sitting down in a chair. Now, the modification for this is if you're not ready to bring your thighs parallel or your hips below your knees, which is perfectly fine to get started, then you're going to put 1 or 2 cushions or pillows in a chair where you just simply do a squat about 20 to 25% of the way so that the buttock is touching then the pillow, and then stand up. This is going to strengthen full body. One of the best exercises that you could do all around for the body. It's going to strengthen quads, glutes, hamstrings, and then your core. What you want to be focusing on is doing 20 of these per day. Well, doc, there's no way I can do 20 a day. I totally get it. So remember, progress, not perfection. So wherever you're at, if that means doing 1 per day, then you start with 1 a day. And then you build from there. And hitting small singles every single day is going to be leading to big results down the road. Right here, Superman's or Superwoman. So how you're going to do this one is you're going to lie face down on your stomach with your arms and legs extended. Now this woman here, she has a yoga mat. So you don't have to feel like you have to do this on a hard surface. Get a yoga mat or some sort of cushion down. You're going to keep your neck in a neutral position, keeping your arms and legs straight, but not locked, and torso stationary. Simultaneously lift your arms and legs upwards towards the ceiling to form an elongated U shape with your body. Back arches and arms and legs lift several inches off the floor. Hold for 2 to 5 seconds and lower back down to complete 1 rep there. It's going to strengthen the back and the glutes. So as you're lifting, make sure you're squeezing the cheeks. Now, you might be looking at me through this camera. I can see you, by the way. And you might be thinking, my goodness, is he really expect me to do something like that? Well, there's some modifications here. You can keep both of your arms and your feet on the ground and simply lift up your right leg and then your left arm, and then lift your left leg and your right arm and do that alternating. That's the modification right here. And if you can only lift off an inch off the ground, then great. If you can only hold it for 1 second, great. Start there and then build up. Ideally, you want to be doing 3 sets of 10 with this exercise. Here's a curl up. This is a very important one. This is going to strengthen your stomach muscles and your abs. So you're going to lie on your back with one knee bent and the other one straight. Your forearms underneath the lower back for support. What I want you to do is gently lift your head and upper body only until your shoulder blades are off the ground. Don't bring your body all the way up. This is not a sit-up. Then return to the starting position on the floor. So very simply, pick a spot on the ceiling that your eyes are going to stay focused on. Work towards lifting your head and upper body until your shoulder blades are off the ground. If you can only get the upper part of the shoulders off, but part of the shoulder blades still touching, start there. The goal would be 3 sets of 10. And if you can only do 1 set of 1, start there. Bridges, one of the most important exercises here for glute stability, spine and core stability. It's going to isolate and strengthen the glute muscles and hamstrings, and it's going to help bring more stability to the core. So what you're going to do is you're going to lay on your back with your hands to your side, your knees bent, and your feet flat on the floor. Sometimes it can be very helpful to maintain good posture by putting a small round plastic ball between the knees to allow for some sort of gap there. You're going to tighten your abs and your buttock muscles. So remember, squeeze the cheeks. There's a theme here, as I'm telling you, when you're doing these activities and exercises, squeeze the cheeks. Unfortunately, people's glute muscles are deactivated and deconditioned so much that when you go to lift something, you're not lifting properly. You're lifting with your back muscles, and your back is very vulnerable with your activity. And it can be just one move that herniates a disc and can impact your quality of life moving forward. So make sure that we're squeezing the cheeks. What you're going to do is raise your hips to create a straight line from your knees to your shoulders. Squeeze your core and try to pull your belly button back toward your spine. Lower yourself back to the floor. We're not going to get points for trying to rush or speed through this. Just slow, controlled movements. Again, 3 to 10. It's 3 sets of 10 that you want to do. You might be thinking, hey, doc, there's no way I can do 3 sets of 10. I understand. Start with 3 sets of 1, 3 sets of 5. Build your way up to 10. And what are you going to do if you have pain? That's right. You're going to stop, listen to your body. You're going to let myself or Dr. Travis know on your next visit in the office, because clinically that's going to tell us something relevant. I love this one, straight leg raise. This is a lot harder than what you think it is. And if you're not able to do this one right now, give yourself some grace and give yourself an opportunity to grow into this. This is going to strengthen your hip flexors and your quads. So what you'll do is you'll sit with your legs straight out in front of you, bend the knee of your other leg to a 90-degree angle, keeping your foot flat on the floor. Then slowly lift the working leg 3 to 6 inches off the floor by contracting the front thigh muscles. That's going to be your quad, your hip flexors. Hold for 5 seconds. If you can't hold for 5 seconds yet, how long are you going to hold for? Start with 1, build up to 5. Then slowly lower your leg to the floor, relax, and repeat 10 more times. Then you'll repeat with the other leg. So with this, you'll do 3 sets of 10. You see there's a rhythm here to this? 3 sets of 10. If you can't do 3 sets of 10, do what your body can do. And with these exercises, you're going to want to focus on doing them 3 days a week. So you'll do them every other day. So you'll do 3 days active, and then you'll have 4 days of rest here. Now, in those four days of rest, it doesn't mean that you can sit on the couch like a potato, but what you can do is get out and walk. Simply 30 minutes of walking will do the body really good. I love this one. Out of all these, this is my personal favorite. I love cats and dogs. This really helps with imbibition, helps with the blood flow to the discs, the joints, the soft tissues around the joint, and really helps the nerves. This will warm up your spine, release tension in your lower back. So you're going to kneel with your hands planted on the floor in front of you, shoulder width apart, and your back parallel to the floor. You're going to roll your chin towards your chest, and as you raise and curl your spine towards the ceiling. That's the bottom picture. Then you're going to curl out of this position until your head and shoulders are erect, facing outward, with your spine slightly curved towards the floor, making sure your abdominals are still pulling toward your spine. Return to starting position and repeat. So what is this one? How often are you going to do this? Every 3 days. You're going to do this 3 sets of 10. Child's pose, a really great one to stretch out the muscles of the lower back and release the hips. So you're going to come to your hands and knees with your hands shoulder width apart, knees hip width apart, abs engaged, back flat, your spine's in a neutral position. Keep your knees and ankles separated and the tops of your feet on the floor as you shift your weight over your heels, lengthening the spine, relaxing your head and neck and reaching forward through your fingertips. One of my favorite ones also, this rivals the cat and dogs, but I love this one and I really love focusing on my breathing during this. It's a really great position to help relax your body, help relax your spine. The pigeon stretch, this is an advanced stretch right here. And I'm going to show you some modifications on this one. Unless you're really accustomed to doing this, I would avoid this particular way of doing the pigeon stretch, and let me show you a different way. But this is going to stretch the piriformis, the IT band, and other hip rotators. This is important because when you stretch the piriformis is a muscle deep within the buttocks, and underneath the piriformis, deep to the piriformis, is your sciatic nerve. So literally, this will cause you a pain in the butt if we don't stretch this properly. So let me see if I can back up enough on this camera, get a good angle in here. Let me just lower this a little bit here. Okay, so as you're seated, a great way to do this, an alternate, is that you're going to take your one ankle and go on the opposite knee. You're going to sit up straight, slightly press your knee down, sit up straight, and then lean forward. All right, I am feeling a great stretch with this one too. It's such an awesome stretch to open up the hip, the IT band, hip rotators, piriformis. Then what you'll do is then you'll bring this down after 30 seconds, bring the opposite knee, the opposite ankle on the knee, and then sit up straight and then lean forward. All right, I got some homework to do myself this evening as some more stretches. So I get ready for my workout tomorrow morning. So sit up straight and then lean forward. You're going to hold this stretch. And I did not mention on the child's pose, that's a stretch also. So what you're going to do is you're going to hold this stretch for 30 seconds and do that for 3 times. The reason why you're going to aim for 30 seconds is it helps with the muscle memory. Okay. Good stuff or good stuff here. We're almost done, gang. All right, kneeling hip flexor stretch. One of the most important stretches that I could ever teach or show you also on this one. So you're going to stretch out the hip flexors and stretch out the psoas muscle. The psoas muscle attaches to the front of your lower back, goes through your pelvis, it goes right into the hip socket. When this gets tight, it gets tight from a lot of sitting, is it's going to pull abnormally in your lower back. So you want to kneel on a mat. Don't kneel on a wooden floor, concrete surface. You'll hurt your knee. So you want to have a mat, a yoga mat, some other mat, and bring your right knee up so that the bottom of your foot is on the floor, and extend your left leg out behind you so that the top of your foot is on the floor, just like the lady is pictured here in the diagram. Shift your weight forward until you feel a stretch in your hip. What's important is the knee that is bent, the forward knee, make sure that the knee does not go past the toes. Otherwise, you'll be putting harmful stress in the knee joint. You're going to hold this stretch. It's a stretch. So for how many seconds do you hold it? That's right. 30 seconds, you're going to hold it, do 3 sets, and then repeat for the other side. And when I say repeat, you can go right side 30 seconds, do left side 30 seconds. Right side, left side, right side, left side. You can go on that pattern. So it says here, fitness is not a luxury. It is a necessity. I heard one of my wellness instructors once tell me, how often do you need to exercise? Somebody said, how often do I need to exercise? They said, only on the days that you eat. So keep that in mind. All right, what fits better? What fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? All right, we know that exercise is important, and it's an essential nutrient to your health and wellness. So those are just some of the things that I wanted to share with you to help bulletproof your lower back. Of course, we could have taken this a lot of different ways tonight, specifically nutrition, supplementation, sleep, sleep positions, stress management, so on and so forth. But I wanted to give you these nuggets. Get started with that 3-legged stool. Number 1, keep your adjustments in rhythm. Number 2, break bad habits. This has to do with sitting too much and too much technology time. And then the third thing, start introducing healthy exercises, the ones that we went over, to help strengthen the muscles along the spine. And if you're curious, what should you do? If you have a loved one at home, if you have a friend, a family member that you want to get checked, we have a great opportunity. And this is how we know we can help. The third reason we have a healthcare crisis is procrastination. We think that maybe it will just go away. So a wise doctor once said that procrastination is the thief of health. So thank you all that are currently patients here in the office for taking action toward your health and wellness. It's an honor to serve you and your family members. And if you are a guest on this webinar this evening, my encouragement is reach out to the office and schedule your first visit. Let's sit down, let's discuss what your concerns are, what your goals are. Let's do some objective tests, find out if we can find the root cause of the problem, see if you have subluxation that we can help. And based on our findings and your goals, we'll make our best set of recommendations for you to help you on your journey, to help save you time, money, and energy on your health and wellness journey. So thank you all very much for being on this webinar. I look forward to seeing you at your next appointment and hearing what your golden takeaways are. And let's consider this to be an ongoing dialogue, communication. Thank you for carving out an hour of your time. You're worth it. So if you want to get good at something, including your health and your wellness, you're going to need to invest time into it. Use me as a resource, as your coach. I've done the heavy lifting. I study this stuff and implement it in my own life. I share it with my wife and my 2 kids and my family. I share it with my clients because we care. So use our time and energy and talents and leverage them to help you get to where you want to be going. Next month is all on neck pain. So make sure that you register in advance. My commitment to you is we will figure out the subluxations and the technology and make it smoother for next time. Sorry for any inconvenience there, but thank you so much for attending. Have yourself a wonderful night. We love and appreciate you. We look forward to seeing you soon in the office. Have a great night. Thank you so much.